Hi, I'm Ruth Wiles with First Quality. First Quality is the largest manufacturer of incontinence supplies in the U.S. And 99.9% of everything in our product, the packaging, everything is made in the USA. And as a company, we're very, very proud of that. The first thing I want to talk about when we talk about incontinence products is there's two things that will usually cause leakage, and that's wrong sizing and wrong application. So we're going to go over that today. And the first thing I always ask is, how do we know what size somebody wears? I get a lot of things like whatever's in the room, we trial and error, whatever they look like. But honestly, best way to tell is get your little tape measure and measure hip bone to hip bone. Takes that times 2 and look on your packaging and it'll tell you exactly the waist size. And the reason we do that is when you look at body shape, we do have at First Quality the charts. They're like pantyhose charts. We go height, weight, and that's what size you should wear. But everybody has a different body shape. Some people weigh 200 pounds and they're thin here, and then God blessed them in the back. Or they can be pear-shaped. So really, the thing to do is do the measuring. We suggest that you do that once a quarter, once every 6 months. People lose weight, people gain weight, they're put on different medications that can affect their weight. So you always want to make sure that the sizing is correct. Now, when we talk about product, first of all, I want to talk about polymer. Polymer are the little white beads that are in all incontinent products. And what happens is the void goes down into the product, hits those little white beads, and it wicks away. But each product has a different amount of polymer in it. First, we'll start out with the bladder control pads. These come in an array of different sizes, lengths. This one's for the female. We do have one for the male. But this has the least amount of polymer in it of any product that we carry. This is made strictly for dribblers, someone who sneezes and dribbles. This product won't hold any more than that. But it does have the sticky on the back, so it'll fit in their underwear. And a lot of the older ladies like this product. The next step up is what we call protective underwear. Kimberly Clark has the patent name of pull-up. Now that I've said that, we're going to call it a pull-up, okay? Pull-ups have a little bit more polymer than this product, but there's no pull-up out there that will hold the whole void either. So this is made also for dribblers. It's made for people who get right to the toilet and maybe dribble before they get set down. But the perfect candidate for a pull-up is someone who can say, I need to go to the bathroom now, or they take themselves. Now, I had talked about polymer in the products. Well, the polymer in the pull-up is right here in front. So you want to make sure that you don't get these on backwards. So the thing that we do is we stamp the size in the back. So we call that tag in the back. And residents will know in their underwear they always had a tag in the back. So if they're putting these on themselves, the tag goes in the back. And also for the caregiver, it's easy to tell. We also have our comfort fit. The stitching goes all the way down, so it fits more like underwear. It's more comfortable. If by chance they would have a big mess that you need to in their pull-up and you need to clean them up, these will rip down the side so you don't get them all over, don't get the mess all over the legs when you're taking them down and up. So that's a plus for pull-ups. Now, a lot of times people are in pull-ups that really shouldn't be. First Quality, we always say if you use more than 3 to 4 pull-ups a day, they're in the wrong product. And the reason why is expense. Pull-ups are very expensive, no matter what brand you use. So the next product up is the pant liner. This is exactly a brief, but it doesn't have the side panels on it. So what that means is people can use them in their own underwear, which they love because that's dignity for them, or free of charge we will give you as many mesh pants as you need, or going back to my day, the snap pants. And these go actually up to a size 4X, so they're really good for the bariatric resident also. These have the wetness indicators, and it has the sticky, so it actually will stick in the underwear. There won't be any chafing, there won't be any sliding back and forth. But also, and with any product that has the wetness indicators, you can have false positives. I go into facilities all the time where I see these people sitting in chairs or laying in bed. They've got 7, 8 covers on them. They're saying they're cold, but they're sweating. You can get a false positive with sweat on these, and you can also get a false positive with humidity and sweat. So I always tell everybody, check them like a baby diaper. Make sure that they're wet. But the pant liner is excellent, an excellent product in lay of going to a brief but not being in a pull-up. The next product would be the brief. And we have different kinds of briefs. This one that I'm going to show today is the stretch fit. It stretches, so we have 2 sizes. A size A with the lavender, and a size B has the beige. If you look at this product, you can see kind of a green tinge to it. This product has aloe, chamomile, and vitamin E all throughout the product. And I visited with a lot of different nursing homes that have been able to cut down on their barrier cream and some of their peri-washes and things because it's already in the brief. But of course, that's up to the facility. We don't make a recommendation on that. Now, as I said, they stretch, and all of our fasteners on all of our briefs are the same. They're not sticky, no matter which brief it is, but they will stick to everything. So we always say keep them folded over. And this is, as I said, in all of our briefs, we have the same tabs. The thing that's good about those are, and I'm going to kind of show you, is once we get ready to stick these, as I said, they're not sticky. So you can bring them over, and they're not Velcro, but they're like a Velcro material. And you know how Velcro, you want to cinch those down. So you give it a little rub around, and those are not going anywhere. That's going to stay on. But then you can pull it up, and you can do that all day long. Just keep giving it a rub. If you get anything on these tabs, on this one or any of our other briefs, if you get aloe, if you get lotion, if you get soap, if you get barrier cream, anything on those, just make sure that you give it a rub and it will sink down in. The other thing that's really nice about the ones that stretch, and we have several different briefs that stretch, is you can bring it out to the side when you go to toilet someone, give it a little rub, and these are just like the protective underwear or the pull-up. And then when they get done, back over and give it a rub. So it's very, very easy to toilet people in our briefs that stretch. As I said when I first started, the thing, if we see leakage, it's usually in the application or in the sizing. And we went over the correct way to size. So I'm going to go over the application. And normally, when we put a brief on, we just kind of throw it on. And a lot of times we have this little pooch here. And what that can do is make little pockets so you can get pooling. And with pooling, it can come out the side. The urine doesn't go right into the brief. So what I want to show you is our company, we teach to put on with a taco roll. And the taco roll, you take your brief and you fold it this way, wrong side, okay? And we say it looks like a taco roll. Some people, including myself, think it looks like a shrimp, so whatever. But what needs to happen is this needs to touch. And when this is touching, the void has nowhere to go but down in that brief. So there's going to be no leakage because there can't. It's going down in the brief. So what happens is when you pull it up, it goes right where it needs to be, comes straight across, right up, and you can't have any leakage because there's nowhere for it to leak, as you can see. Then, if we have someone that's in bed and they're laying down, we take the brief and we roll them, give it a little tug, and then with your gloved hand, you pull half. And that will come right up to where you want it to be, so there's not going to be any leakage. If you can get that taco roll down, it is a lifesaver. You will have hardly any bed changes, shouldn't have any clothes changes, anything like that. So that's an excellent product. The next product I'm going to talk about is a lot of things we hear nowadays are quality of life. And that is people need to sleep. I go into a lot of nursing homes, 9 o'clock in the morning, everybody's in their wheelchair and they're slumped over asleep. That means they didn't get good sleep at night. So we have an extended wear product, and depending on the void, normally you can get 5 or 6 hours of sleep, if not more, out of this product. It has the same properties as the brief that I just showed you. It stretches, it has the same fasteners, and it has the aloe, chamomile, and vitamin E all through it. But our extended wear product, it has the most polymer of any product out there that we have, but we have our thin core technology. I know a lot of our competition with the extended wear, they're real bulky, but it's all fluff. We want the residents to be comfortable, and this is a very comfortable product. So we do have the extended wear. And then we have several different wipe products. And I wanted to talk to you about wipes because wipes are very misused in facilities. Wipes are expensive, but the aides love them, and they do have a purpose. But whenever you're cleaning someone up, the first thing that you should do is use the brief up the back to get the first layer. Or to get the pull-up, you tear it down the side and up the back to get the first layer. Then you should always use toilet paper. One time with the toilet paper. And then you can use your wipe. And if you hang on to ours, you'll get one at a time. They're very big. They're very sturdy. And I know a lot of people say when the state comes in that they're scared to use wipes because of the contamination. But it's just like a washcloth. You can fold it like a washcloth and use it that way and keep folding it. So there shouldn't be an issue there. But honestly, it should only take 1-2 wipes at the most to finish cleaning someone up. But it leaves a fresh scent, and they're very nice to use. Okay, our recommendation for pull-ups is if you're using 3 to 4 pull-ups a day, that's fine. But if you're using more than that, they're in the wrong product. Pull-ups are a very expensive product, no matter whose they are. All the budgets are being cut. People are trying to cut down on cut down on expensive products. The person who needs to wear the pull-up is someone who says, I need to go to the bathroom now, or can take themselves. Double padding is not okay. And what we find is I see this a lot in the nursing homes, that they like the pull-up, so they put it on, but it's not holding enough. So then they decide that they're going to put this pad inside. But what happens is there is nothing coming through this pad. I mean, nothing. So what will happen is this will get full, and then it's just going to go out the side of the pull-ups. So basically what you have is the product, which we talked about with the least amount of polymer, being held up with the most expensive product there is. That doesn't work. And also with that being up there like that, they're more susceptible to UTIs, skin breakdown, so it's just not a good idea. And that's why if this product, a pull-up, isn't holding enough, and they don't want to go to a brief because that connotation of being in a diaper, even though we call it briefs, they call it diapers, that's where the pant liner is an excellent, excellent product because they can use it in their own underwear. Barrier cream is great. You can use it with our products, but with any incontinent products, and let me kind of pull this one up here. All incontinent products have tiny, tiny little pores. Can't even see them. We'd have to have a magnifying glass, but for the void to go down in. So what will happen is if you use too much barrier cream, I think it says like a dime size, which is great. You know, smother that on. But if you cake it on, like I've seen a lot of people do, it will clog these holes and the void will not go down in the brief. It'll just start going out the side. But that's with any incontinent product. But yes, you need to watch how much you're using. Yes, with the tabs, since they're not sticky and they're like a Velcro material, all you have to do is put them down, put them on, and give them a rub, and they'll stick every time. If you get anything on them. And that's one nice thing about them. They don't tear the brief, and you can use them. Okay, the mesh pants, we have these up to a size 2X. But what I always say is, if you get anybody with this roll right here, and you put this mesh pant on, it's going to look like a thong, and that's just not right in the nursing home, okay? Because they are short. They're like a boy pant because you want that pant liner to be held up close. So these go up to 2X, but the snap pants go all the way up to a 4X. But the thing that I always encourage people is let them use their own underwear. Talk to the families. The families think it's great when mom or dad are in their own underwear. So that would be my first suggestion. Okay, and I'm going to talk about two different wipes. I don't have the other one with me today, but this is a wet wipe. It's our ProCare line. Great wipe. People use it all day long in the nursing homes. But honestly, wipes get overused and they are expensive. So the first thing you do when you clean somebody up is the brief is the first thing up the back. The second thing is toilet paper. And by doing that, you should only need 1 or 2 wipes when you're cleaning someone up. Now we do have another wipe that has aloe, chamomile, and vitamin E in it. And that one especially you want to keep on the skin because it has all the skin products. So once again, it's the brief or the pull-up, the toilet paper, and then the wipe. As long as you hold down with your one hand and pull, it's going to come out one at a time. The thing about these wipes, even though they don't have the aloe, chamomile, and vitamin E in them, it keeps them refreshed. There's a good smell. And it's a good wipe. They're moist. They're going to work. And as long as, the main thing is to keep this closed so they don't dry out.